Hi, I'm Dr. Bob Margeas, and I practice full-time general dentistry in Des Moines, Iowa. I'd like to share a little tip with you today about when patients come in hygiene and you're doing the examination, and a lot of times they'll say, you know, doc, this tooth hurts when I bite on it. So what do? We take a tooth sleuth out, we put it on the cusp, we try to see where the crack is, and they say, yeah, ow, that hurts. And I look at the patient, I say, you know, it appears that you have a crack in the tooth. My suggestion would be to place a crown on that tooth. Hopefully placing a crown on that tooth is going to solve your problem. You never know though, because if the crack goes deeper and it goes to the nerve, you're going to have endodontic therapy, and then we'll still be able to put the crown on that and save your natural tooth. The worst case scenario would be if the split is through the pulp chamber and you aren't going to be able to restore that tooth. And I say that's the worst case scenario. But my first suggestion is always to put on a temporary or a crown. And they kind of look at you and they say, well, doc, it doesn't hurt that much. It only hurts when I'm like chewing on a taco chip. I said, great. I said, you know, the worst case scenario, as I said, is you could have a split tooth. And nobody dies usually by having a split tooth. You may have to have an implant. That's the worst case scenario. I said, I'm not here to biopsy your wallet. I'm basically just a referee. I'm a ref. I call it as I see it. Ultimately, though, it's your mouth, it's your time, it's your money. When you decide that you want to have that done, just let us know, and we're here to help you. Because if you try to talk somebody into having something done that they really don't want to do, and then things start going bad, it's your fault. And so I'm basically just trying to educate the patient, not talking them into having any type of dentistry that they don't value. And so I think in the end, when you feel bad for patients and you do bad things, or you try to help them out when it's not the right thing to do, bad things happen. So just tell the truth, educate the patient, let them make their own decision based on the facts that you give them.